that the centers may have. So Michelle and Jordy.
And turn it right over to Michelle, our database expert.
Thanks, Jordy. Okay, hi everybody. I'm Michelle. It's nice to see many familiar faces and some new faces too. My name is Michelle Tissue, and I work with Jordy in the Division of MCH Workforce Development, and do a lot of work with our performance measures and data analysis. So I will try to share my screen and see. You can let me know if this.
It looks like it's happening. Yes.
Yep.
Okay.
And if I can just break in real quick to let everyone know I am recording this session. If that's okay with everyone, Angela suggested that so that other people could look at it, or if we questions go back to that. That's okay, Michelle?
That works for me.
Okay.
I'll be on my best behavior.
Okay.
All right, so I'm going to do a quick run through just of the types of reports, reporting requirements, and then we'll make sure we have a few minutes for questions. I realize that some of you have heard this information before. Hopefully it's a good refresh. And then for anyone that's new, I'll try to just run through some of the terminology we use, the systems pieces as you undertake reporting for your Pediatric Pulmonary Center grant. So as you may have already figured out, there are 3 different types of performance reports. I know you have this table in your slides. It's also in the NOFO. So if you are ever wondering about the types of reports, you can always go back to that HRSA NOFO and look for this table, which describes the types of reports, and this is consistent across MCHB grants. So the first type of report is a new competing performance report, where my red arrow is. This is a report that should be available to you right now in EHB. So we use the word Discretionary Grant Information System, or DGIS. It's really just the platform within the electronic handbook, or EHB, that you use to fill out your performance report. So I know sometimes that causes confusion when we talk about DGIS and performance reports and EHB and how all of those fit together. So just know that all of your performance reports are always submitted in EHB, the electronic handbook. DGIS is simply the platform that's built into EHB by which you actually fill out your performance report. So right now in EHB, you should see a new competing performance report. You will notice that the reporting period is July 1 of 2020. And in EHB, it will show through June 30 of 2021. So it looks like it's looking forward a year, which many people will look at and say, why am I reporting data when I just started my project? I don't have any data to report on. You are not reporting any actual data in this report. This report is released at the beginning of any project period when you have a Maternal and Child Health Bureau or MCHB grant. I realize yours were a little delayed, so apologies for that, but know that these generally get released right as your project starts. What we're asking you to do in these reports is fill out some administrative data. So you enter data about your abstract, about your project activities, and you set some performance objectives on a subset of the measures. So as you think about looking forward over the 5 years of your grant, and I'll talk about this a little bit more in a bit, we ask you to set some targets as you're thinking about recruiting diverse trainees or working on cultural competence and family involvement. So you do not have to enter any actual data on this report. It's just setting targets and entering administrative data, and you do it once and then you don't have to do it again. So hopefully that alleviates some concerns about what this report is all about. As you move forward over your 5-year period of performance, you will have what's called a non-competing performance report that you fill out at the end of each budget period. So in HRSA world, in MCHB world, every budget period is 12 months. It's 1 year. We fund our grants 1 year at a time. So at the end of a 12-month budget period, you will get a non-competing performance report where we say, hey, look back over the last 12 months and report on the measures and forms that were assigned to you and tell us what you accomplished on those forms and measures over the past 12 months. So those will be available to you at the beginning of the next budget period. I realize this is a little confusing. So if you think about the current year, where your budget period is July 1 of 2020 through June 30 of 2021. Well, on July 1 of 2021, EHB is going to release a performance report that's asking you to look back over the last 12-month period. So even though you don't have that report available to you yet, you should be thinking about and familiarizing yourself with the measures and the data that you're going to be expected to report on at the end of this 12-month period. And I'll pause in a second and make sure there's not questions about this, but essentially that process will repeat at the end of year 1, at the end of year 2, 3, 4. So essentially that will happen 4 times until the final year of your project. And I do not know why the final year report has a different name. There's nothing that special about it, but it's called the Project Period End Performance Report. It is still only collecting data on 1 year, the final year of your grant. So this is the report that will collect data from year 5 of your PPC grant when you get there. I did just want to make sure you know the terminology differences. So as you hear us talk about the various types of reports, you won't look at us like we're totally crazy, even though I know there are nuances in terms of the terminology. The only other difference with the project period end performance report is that you only have 90 days to fill that out. And for the other reports, you have 120 days. And of course, if you ever have problems or questions about the due dates, Jordy is your best resource for that, and you can always reach out to her, talk through any issues. If there are system-wide issues or technical glitches, we will always extend your due date. So for example, when performance reports are delayed on a whole being released, you're not penalized for that. We just extend the due dates proactively. Okay. I'm going to keep moving, but then we'll come back and can do questions. These slides are really just a reminder of the measures that are assigned for the PPC program. Again, you should, there's a link in the PPC NOFO and also later in this presentation where you can be reminded of what your assigned measures are. I tried to categorize these the way you will see them in EHB. So if you are a new grantee, hopefully you've logged into EHB and you have looked at what the system looks like, and you'll see that the measures are categorized according to 3 or 4 high-level categories. So for example, your financial forms, that's a lot. Those are some of the pieces you'll fill out in this new competing report where you're just entering some administrative data and other project abstract information. On the whole, MCHB has organized its measures that we use across divisions into some categories. So you'll see core measures here. There are 3 core measures that every MCHB grantee reports on around grant impact, quality improvement, and health equity. And then a lot of our training measures also fill out a number of what are called these capacity building measures. And if you see a CB, that's what CB stands for, so capacity building, or CB. And that includes technical assistance, products and publications. These are also measures that are used across MCHB divisions and offices. And then our division, the Division of MCH Workforce Development, has a number of both training measures and also workforce forms that are really important and unique to our MCH training programs in terms of the data we collect and how we really talk about the impact of our programs. So you will see listed on this slide more of the division-specific or program-specific measures that are assigned to you. I'm not going to walk through all of these today, but just know that if you have questions about a particular measure, a particular form, happy to spend time on that at a future committee meeting or just talking with folks one-on-one. You can always reach out to Jordy as well to be a resource to you. Do want to make sure that everyone knows, as you should have seen in the NOFO, training 10, 11, and 12 are follow-up measures. So there is an expectation that as your trainees complete their training, that you are keeping tabs on them and keeping in touch with them. And we have a former trainee survey I'll talk about that in a minute, but like to spell out that expectation up front so that you know, even as your trainees are graduating, you know, we're so proud of them and it's nice to wave them off to their next job, but we do expect you to really keep tabs on where they're going so that we can talk in more depth about the impact of our training. And I cannot emphasize enough, and I sound like a broken record to those of you that know me, that this data is so, so critical for us in being able to talk about the impact of the training and where your trainees go. So I know that has been a discussion point over the years in terms of best strategies and best practices for following up with trainees, and I'm sure some of those conversations will continue over the next 5 years. So this it should look familiar. Hopefully this is maybe a hair different than what you see because it's my project officer view, but this is what the DGIS homepage looks like when you go to actually fill out a report. You should, in the left menu, see all of the various measures and forms that are assigned to you, the date the report is due, how many days you have until submission, and then an ability to click on any of the forms or measures to toggle to that particular screen to fill it out. Again, if you haven't yet spent any time even just playing around in DGIS and clicking around, would encourage you to do that before, like a couple days before your report is due. Make sure you can access the report, make sure you know, you're not having any particular issues with data entry so that we can try to work with you to get those resolved before your report due date. I'll call to your attention, this is around setting performance objectives. So this may be what you're thinking about now as you complete what's called your new competing performance report. This applies to our training measures. So you may log into your EHB and say, well, for the health equity measure, I don't see any way to set a performance objective. And that's because not every measure requires you to set a performance objective. In general, the measures that are MCHB wide do not require you to set a performance objective. Your training measures, so anything that has a training in front of it, training 1, training 2, those you should log in to EHB and be able to see the ability for 5 years to set performance objectives. And you will see this little box that I've pasted onto the slide that appears at the top of that particular measure. So it will say for new competing reports, you must provide objectives in section 1. And then it will also give you a reminder, although maybe not applicable right now, that as you move forward in reporting, you won't be able to go back and change your targets, but you will be able to look forward and say, you know, I set 5-year objectives. Now I realize I was way off and I need to reset those objectives for years 3, 4, and 5. You won't be able to change year 1, you know, as year 1 has passed, but you would be able to, on future reports, say, I need to tweak my performance objectives a little bit for future years. So that's just a reminder to spend a little time thinking about those objectives as you fill out the new competing report. For new programs, if you ever have questions about how to set those targets, again, reach out to Jordy. I'm happy to work with you as well to think about those targets. Tiered measures. So most of the measures that have, you know, core or capacity building are in this tiered structure, which I know can be a little bit confusing if you haven't worked through the system before. So just did want to call your attention to that. If you see in DGIS measures that have labels at the top, so tier 1, you should see on this screenshot, it means you're going to have to go through some steps when you actually go to enter your data. So any measure that we've assigned to you that's a tiered measure, we generally expect you to say yes to tier 1, that the measure applies. If you answer no, you'll probably get a follow-up question from Jordy saying, you know, we assigned that measure on quality improvement to you and you answered no. Is there a reason you answered no, or that you're not working on quality improvement in your program? So in general, for these tiered measures, the ones that you see available to you, you will answer yes for tier 1. As you enter data in tiered measures, you will only be able to get to the next tier if you answer the tier before it. So I have to answer tier 1 and then hit this nice little continue to the next tier to have tier 2 be a fillable area for me. And then I do the same thing to get to tier 3, and then eventually tier 4. So if you log in to your annual non-competing performance report and you say, well, I can't enter anything in tier 2, you may need to look at whether you've answered the tiers in the right order to be able to toggle the full data entry experience. Again, I realize like many of you may not have experience doing kind of the annual performance reports yet, so you can kind of tuck this away for a rainy day in a few months, and then we can always talk about it in the future. Tier 4 is always optional. And I say that because if you look at DGIS and you think, oh my gosh, I'm responsible for collecting this, client level data or outcome data that I wasn't expecting, tier 4 is always optional. And for our training programs, it's generally not, we don't have the expectation that you would need to fill out data in tier 4. It is even labeled as optional in the system. So if you forget that it's optional, there's a nice little note there next to tier 4 that it's optional. So as you familiarize yourself with the measures, if you have questions about what you really need to be collecting related to these tiered measures, reach out. But hopefully it doesn't cause too much panic thinking about data that you see in tier 4 that you may not actually be expected to collect.
Michelle, this is Claire. There's a question in the chat from Ellen Bowser that says, for this first performance report, like the new performance report, would we only be answering for tier 1?
Yes, that's correct. Yes. So just answer yes and move on, and then you'll consider the other tiers as you actually submit data to us at the end of this first budget period. Thanks for your question, Ellen. So just a couple of reminders about data quality as you think about too how you're tracking data. So we collect a lot of data about trainees as part of DGIS, and in this kind of newer iteration of DGIS, for those of us that have been around a while, there's actually a number of validations that are built into the system to help us all be more accountable in terms of data quality and data consistency. So this is particularly true for our follow-up measures, which are training 10, 11, and 12. So for those measures, you're collecting data from your trainees at 2 and 5 years post-training. We understand that you're going to lose track of some trainees. That's totally fine. That the expectation is not that there's always 100% response rate, but we do expect that as you track your trainees, that there's consistency in that baseline number that you're reporting. So if you tell us that, 2 years ago, I had 100 trainees, you should have 100 trainees across training 10, training 11, and training 12. Now, you might have lost, 10 on one measure and 15 on another measure, and then 20 on another measure because people leave various parts of the survey blank or you don't have the answer. But I just like to make sure people know that as you're tracking trainees, we expect some baseline consistency in terms of how you're reporting that data to us. And that is true for both the 2-year follow-up time period and for 5 years as well. And then just make sure as well as you're thinking about your current long-term trainees. So training 6, which is the measure where we collect the diversity of long-term trainees, you report the total number of trainees. You also report race and ethnicity breakdowns. The total on that needs to match how many trainees you enter on your long-term trainee form, which is the form where you're entering individual level data. So again, as you're thinking about who you're going to report on as your long-term trainees, you need to be able to ensure you have individual level data about those trainees to enter into our long-term trainee form, and that number matches the aggregate data you're providing on race and ethnicity in terms of the total number of trainees. So I know these are kind of in the weeds things, but as people set up their tracking systems, sometimes it's helpful to know about some of the system nuances and that you need to be consistent in who you're classifying as long-term trainees, how you're counting them, how you're tracking them. And I think probably your peers would tell you, the earlier you can set up that consistent tracking system, I think the better off you will be as you think about moving forward and tracking over the years. And then this was just a screenshot to show you some of the fields from DGIS that match. And then finally, just a reminder around faculty and staff. So as you enter faculty and staff information in DGIS, that information gets pre-populated. So we heard that, you know, the dynamic of faculty and staff may not change that much year to year. So just make sure each year, well, it may not. I see Claire is giving me eyes like, I don't know about that. But just know that, you know, you'll have the ability to log in and make any changes to that form. But once you enter data there, it will pre-populate for you so that you don't have to re-enter every faculty and staff member over and over. A couple resources for you and links. So you have my slides. Your performance measure assignments are in a document that's linked on our website. There are some nuances on our form compared to what you might see on the NOFO link. So for example, on Capacity Building 2, which is a technical assistance form, you only fill out tier 1. We don't expect you to fill out the rest of the tiers. So I would encourage you to visit this first link and make sure you've kind of looked at what some of the nuances are in terms of reporting. We do have a series of tip sheets on our website, which we're always open to developing more. So if you have feedback about other areas that would be helpful, let us know. There is an option as you report on products and publications to have an Excel upload template versus entering everything in the system. You might not have to think about that quite yet for new programs, but I like to put that out there. It's a way to keep track of products and publications over the course of the year. And then we also have a PDF, a fillable PDF of our former trainee survey. So even if you're a new program and you're not yet tracking trainees, I would really encourage you to look at the former trainee survey, get a handle on the types of information that we expect you collect from former trainees as you're thinking about setting up your data systems. That's it from me. I realize that was a lot to cover. So let me pause, see if you have questions, and then know that this can be the start of a conversation, and happy to answer any questions down the road.
Thanks, Michelle. This is Ellen, and I actually did have a couple little specific questions because
Sure.
I actually went today and went into the EHB and looked at, you know, trying to figure out how we would answer the forms. And this is just this is maybe a Jordana question as well. It's really picky and specific, but that's how we are. So it's actually financial form 4. And so it's wondering what category we are as a program. And so we're just wondering if we would select public health services and systems.
Yes.
Okay.
So the transformed MCH pyramid
Yes.
infrastructure is still, the categories may look a little different, but our training programs are still considered in that bottom category.
Okay. And so, and then obviously we would not put in patient data. Is that correct?
That's correct.
Okay.
So if you look at the assignment sheet, that first link on the resources slide, you'll see on that one on form 7, you only need to fill out certain sections of that form, and it skips over some of the sections where it asks for like demographic information of participants or like client level data.
Okay.
So we don't expect that of our training programs.
And we're not considered to be a resource / TA
No.
program for training, right? No.
Nope.
Okay, awesome. Those were my questions. Thank you very much.
Sure.
Those were very specific questions, Ellen. All right, other questions for Michelle and Jordy about the performance report? Michelle, can you remind us for the existing centers when the NEARS export takes place?
So it should be done in the next few days. And then we'll reach out once the data has been imported and just ask you to obviously check your data, complete the remaining sections of your report, and then submit when you're ready. Okay.
Okay. All right. Other questions for Michelle? That was a really whirlwind tour of the EHB. And one thing I might want to mention, especially for the newer centers, is that performance measure 14 training 14, which is a PPC specific measure, measures knowledge and skills in medium-term trainees. And so it could be that you're already having medium-term trainees at your center that are coming and going kind of with some regularity, whether they're dietetic interns or if you're planning to count pharmacy residents or your pediatric house staff, to pay attention to when they finish and to try to grab them and complete that measure when they're finishing, because it's hard to track them down later, at least in our experience. And I can see Lisa is nodding, that it's hard to track them down later. So that's one thing to kind of be thinking of right in the beginning. With the long-term trainees, you know, you're not going to track them for 2 years, so you need to know who they are and where they are and how you counted them. But the medium-term folks, much more rapid turnover, and so be thinking about how you want to capture that data right now. Other questions for our...
I was going to segue on that, just as a reminder, is that the medium-term trainees are 40 to 299 hours. For there are 2 levels, level 1 and level 2. The level 1s are the shorter term trainees, and the longer go up to 299. And the medium-term trainee survey is actually, you could get a paper copy, or you can actually log into NEARS and actually send out a code for the trainees. So there's a couple different ways you can get the survey to them, but that's something, again, as Claire said, I think it's really important as soon as they finish to grab them or tell them in the beginning, before you leave, we need you to fill this medium-term trainee survey.
And just to clarify, that medium-term trainee survey you won't find in the package of MCHB measures, because that was developed by the PPCs for that particular measure. So I don't want you to like go searching for it within our resources. You do reach out to one of your peers if you are trying to get your hands on that survey.
Let me see if I can find the link and I'll put it in the chat.
Okay.
Give me a sec.
Thanks, Ellen. Other questions about the electronic handbook and Digis for Michelle and Jordy?
Yeah, I have a question about the new competing report. So I just want to make sure I understand it. So for the new competing report, there's one tier, and it's tier 1. And tier 1 is where we're going to submit information on activities and setting all the targets, and that's all going to be populated in tier 1 of the new competing report.
So as you log in, it will probably be helpful and make a little more sense as you actually log into EHB and go through the report, because each measure or form has a little bit of a different format. So when you log into the new competing report, the first thing you're going to see is a set of financial and administrative forms. So for some of those, it's going to populate like your grant budget. You enter some information on your abstract, and administrative data. As you move into these tier measures, so the core measures, capacity building measures, for those measures, you will just select yes for tier 1 and keep moving, not enter any data there.
Okay.
When you get to the training measures, so anything that has a training in front of it, those are the measures where you will set objectives. And so basically, as you go into the system, you should see, like, you can't set a target on core 1. There's nowhere to set a target on the tiered measures. So as you get into the measures that have a training in front of it, there's like this chart essentially, and it will show the 5 years of your grant and then ask you to set a target for each of those 5 years. And there's a section labeled annual performance objectives. So that's where you'll set targets. And then for the rest of the forms, you'll see them in there, but you just keep moving and submit the report.
Okay, so the bulk of the work for this new competing report is in the training measures.
Yep, is setting performance objectives. And I will say, just give yourself, like, the abstract form is not going to be like a 1-to-1 match for what you had in your application. So we hear that from some folks that they're expecting to just like totally copy and paste. You can repurpose a lot of what's already in your abstract, but just make sure you like give yourself a little time to map the fields. Sometimes we hear from people at the 11th hour, like, I don't know about website hits or this or that. You know, there's a few little fields that may be different than what you see on your, like you put into your application abstract.
Okay, and hard deadline for this is, I think, October 28th, is that right?
So I never will tell you your due date because for everybody it might look a little different. It has to do with when your report was released in EHB. So the algorithm on the back end for that report is 120 days from when the report was released. I think
I remember logging in and seeing that number up there.
Yeah, so for the new
that's about right.
report, it's 120 days and it should be kind of like counting down for you.
It'll tell you every time you log in, it tells you how many days until this is due. So,
for better or worse.
Yeah.
Good.
This is Claire again. I might want to mention one other thing for the new centers, or for people at centers where responsibilities are shifting around due to retirements or just changes. To get privileges to work in the EHB can be a little bit cumbersome depending on your institution. So the individual has to register in the EHB, and then the project officer has to approve them. And I know here we had to go through this match process with our office of sponsored programs where they have to basically say, yes, this person is affiliated with this project, with this grant. And so that took way more hoops than we thought when we changed a few things around. And so Lisa's nodding yes. So just know it's not a click open, the week before and it all gets done. There can be some time lags in there with getting the right people to have the right privileges and get that done. So
I just have
other questions.
Yeah, this is Knock. I just have a clarifying question. So there's been a lot of email about financial report being migrated to a different system, but the financial form are still being submitted in EHB, correct? I think you're mute, Michelle.
I'm muted. I was chatting away about financial reports. So the federal financial report, the FFR, that's being migrated to a new system is the official accounting to HRSA about your grant. The financial forms that are in your performance report are not official accounting or budget forms. So I realize that's confusing. Essentially do your best on the financial forms for the performance report is what I'm going to tell you. Your FFR, you need to cross your T's, dot your I's. Your financial office will definitely work with you on that one to get it submitted. That's going to be your official record of unobligated balance and carry forward and those sorts of things. The financial forms in your performance report, it's reviewed by MCHB staff. It is not an official budget form. So I know people wonder oh, I don't have my FFR submitted yet. How can I do this financial form? I will say that a lot of grantees, it's an estimate, and we realize that the due dates don't always line up. So just know that those financial forms in your performance report are never going to be used by HRSA as the official accounting of your grant.
Thanks.
Okay, other EHB or Digis questions, or should we keep moving? Okay, let's keep moving.
All right, I got to sign off to go
Michelle.
see my kiddos. So thanks for having me, everybody.
Thanks, Michelle.
Thank you, Michelle.
Bye.
Thank you.
Bye.
The next thing I had put on the agenda was I just wanted to take a quick peek at the section of the PPC procedural guidelines that talk about the charge to the database committee. And so I have emailed that to everybody, and just briefly, it is to coordinate uniformly reporting via the MCHB reporting mechanism, serve as an advisory capacity and communication liaison between the PPCs, MCHB, and AUCD, which is the holder of the NEARS system. So any questions about what the database committee is doing or supposed to be doing, or questions about that? Okay. The next thing I kind of wanted to talk about was just to follow up from our meeting that we had. Last time we met face-to-face was February 2019 when we were in beautiful Tucson, Arizona at that great meeting. I can still picture the conference room we were in with this panoramic windows, and it was so pretty. But one thing that we talked about at length was whether or not to try to move to using a REDCap database. And Hannah, who was the pharmacist at Arizona, was really willing to take the lead on that. And so she and I spent some time kind of looking at our reporting requirements and putting together, not a proposal, but putting together information for the REDCap consultant that she worked with at Arizona, and came up with an estimate of around $30,000. And so at that point, the database committee kind of decided to just table that for now, or for then until the competition was over. And so Jordy is messaging it might be worth for the new centers to explain NIRS and REDCap. I don't know how to explain NIRS except to say it's a system. Stands for National, Angela's laughing, National Information and Reporting System is what it stands for, NIRS. And it is owned by AUCD, which is the Association of University Centers on Disabilities. And AUCD is the member organization for the LEND grants, the DDRC grants, and another category of grants that I can't remember right now. But NIRS was built as a data collection system for those three groups of grantees. And over time, through the cooperative agreement with the Maternal and Child Health Bureau and AUCD, it has been opened up to more MCHB grantees to use for data collection. And something weird is happening with my, there we go.
I don't know what happened. Sorry, I was trying to pull up the AUCD and NIRS website, but for some reason I can't. I guess because I'm recording. So I don't know if you want to pull it up to show the new centers. I just can't do it. Or maybe just a thought. Into AUCD and NIRS, have you looked at it? I mean, if you have, you might not want to see it again, but if you've not pulled it up, it might be worthwhile to see what it looks like.
I think the important thing to keep in mind with NIRS is that it was built for other grantees. It was not built for the PPCs. And so we've always had a little bit of being a square peg in a round hole, that it's useful for some things, and for other things, it has not been quite as useful. There is information that's required in there when you're entering activities that we're not required to report as PPCs, but other grantees are. And then there's things that we're required to report that aren't collected in NIRS. So it's always been just a slight mismatch. But it is available for the PPCs and a couple of other training grantees, and all of us use it to different extents. Some centers use it extensively, some centers use it only for certain things. Jordy, is there anything else you would add about NIRS?
I'm new to this too, so actually that's pretty much all I know. But as you've heard, the NIRS database is like our team coordinates with NIRS to get an export to be input, like auto input it into EHB, and I think most centers just utilize it as a tracking tool, so you don't have to create your own data tracking.
Okay. And like I said, each center uses it kind of to some extent. I know when we had a center in Wisconsin last year, they had decided they were not going to use it at all. And so they were using alternative methods to collect their data. So at one point as a group, we had talked about trying to develop a REDCap database to use in place of NIRS, and then the price tag came back Angela says we have a love-hate relationship with NIRS. Yes. So we had talked about REDCap, and then that price, the estimate came back, and it was really pretty steep, and so that was all put on hold. So I just kind of wanted to take the temperature of the current group to say, you know, is that something we're interested in pursuing or not something we're interested in pursuing? The upside to that would be it would add uniformity to reporting. Sort of the downside would be cost, and then one center has to become a coordinating center from what my understanding was from the consultant, and take some ownership of kind of making the regular updates as reporting requirements would change. My take on it had always been, it was kind of a big gun to me for the amount of information that we were asked to collect and report, that I always thought there might be less expensive, more informal ways of collecting the data, especially because we don't do anything with it collectively as a group of PPCs. It's all reported to MCHB. But I did want to see what others were thinking about, was this something we were interested in pursuing or want to just keep putting on hold and circling back to eventually, or what do y'all think?
This is Angela, and I think it'll be really interesting. So $30,000 is a lot of money.
Yeah.
You know, even $5,000 for each center is a lot of money given the size of the PPC budgets that we have. So what I think would be really interesting is for the two new centers, like for them to think about how they're going to gather their data, given that they're now starting with kind of a blank slate in one sense. And as they look at what they need to put into the EHB, think about it, you know, I mean, they obviously can use NIRS, or they can decide, no, we're starting from scratch, so we'll just, you know, as Ellen used to say, she started putting things in Excel and just used Excel for years. And, you know, I mean, and Claire, you've also shared that there are some things that you just almost do it still on paper and pencil and add them up and put them in. Yeah. So, so I don't know that we should give the impression that there's a perfect, or NIRS is, I mean, NIRS has served us well over the years. I think we may initially run into problems with a REDCap system because, as we know, they're only as good as whoever designs them. And so I think that if we track or talk about this over the next year, that we would be in a stronger position going to the steering committee at the end of the year and having put, you know, some of us will continue to use NIRS, or, you know, do what we've traditionally done, and the two new centers may well come back and say, you know what, we have something way more effective and it costs nothing, and this is how we're gathering our data.
Yeah, just so at UCSF we have REDCap available to us, and I guess it sounds like, from my understanding, that we don't need a uniform data, so we can use separate systems. So it's okay for us to use REDCap, for example.
Yes, yeah. So NIRS was put in place really to try to provide that structure, but I think over time, you know, NIRS has gone one way to help support the other grantees, and our data needs have maybe kind of gone another way. And so really, as long as we're collecting the data as individual centers and are able to input it into the EHB and Digis the way that the Bureau wants to, it doesn't matter if you use NIRS or you use REDCap or you use Excel sheets or pencil and paper. That's really whatever works best for the individual center. So it sounds like we want to just continue talking about that and maybe table this and take it up again as to whether we want to work toward a uniform reporting system other than NIRS at some point in the future.
Yeah,
Other
I would-
discussion about that, Ellen?
I was going to say, I actually think that, I mean, as Angela was saying, if, you know, if you see
Yeah.
if is using RedCap, we would love to see how that's worked for you. And if there's a way, you know, if we can after this year, then say, you know, maybe we can develop a simplified RedCap like they're using there in San Francisco.
Yeah.
And you know, if that works for us, that would be fine. I guess I'm not sure I'm ready to go and say, let's all go to RedCap. And, you know, again, because of the beginning of the grant year, you know, I mean, we all have kind of worked out the way that we can collect data that works best for us. And, you know, there's pros and cons to using NEARS, but certainly see what's happening at the end of this year. Maybe then we can, you know,
Yeah.
forward.
And I think a lot of our discussion centered around, so the cost came in because we were trying to build a system for all 6 of us.
Yes.
I mean, I think every academic medical center has access to RedCap. And so at UF, we could absolutely set ourselves up just like you can in San Francisco or in LA or at UAB, wherever. But but we were trying to build this uniform system that, you know, would, we could draw data from it really easily. Because I think the other thing that we're often asked for as centers is, for example, Jordi or her predecessors have often come and said, okay, we want to know X data from your center, and then it all goes together. And I think that that was one of the things that were also trying to think about, that it would be like this central repository for everything. But I don't know that we thought it was going to cost that much money to put it together.
Yeah, I was floored by that cost, frankly. Thought that was a huge
Claire,
amount
I
of
know that
money.
you had asked me how other grants of similar sizes collect their data. And, I haven't had a chance to find that information yet, but I can, you know, report back. I'm trying to think about, obviously, LEND is associated with AUCD, so they probably using NEARS. I think DBP uses NEARS as well, and they're about 10.
What about Leah's?
That's a good question. That's a good question.
Leah or nutrition, or I know they have access to NEARS. Leah has access to it. I don't know how much they use it.
Okay, I'll get back
But
to you with that information.
Okay. Just being mindful of
with RedCap, isn't one of the main challenges that one PPC center has to act as the host?
Yeah.
And so looking down the road long term, there's new grantees and everybody is entering in their data for their center. That seems like it'd be a pretty big challenge. I mean, like Ellen said, there's pros and cons to NEARS, and sometimes, you know, whether it's using an Excel spreadsheet or, you know, playing with exports and NEARS, could the, you know, is your time being saved by migrating to a new group system, or are other things just coming up?
Yeah.
New issues coming up.
Yeah. I mean, we also worried about, you know, the historical data that is in NEARS for the last 20 odd years, and whether that would be maintained, and if we divorced ourselves from NEARS, how we would get access to that information. And so there's lots to consider way beyond just the cost.
Yeah, I think if you're a new center and you set it up independently, I think it would be, I guess, just easier versus centers that, you know, have been around for years, because you're not, you know, you've got those surveys at 2, 5, and 10 years. How do you take some of that data and then put it into RedCap? And
right,
I think it'd be challenging. I think if you developed it off the start, it would be easier. But it is, you know, it is you know, available at all, you know, all the academic institutions. Sounds like, you know, a spendy challenge to get it all to work together.
right.
One of the things that you might lose is the support with Michelle Tissue having a go-to when it's something, I don't know, when you need help with something.
Yeah.
Would
Yeah,
some of those
the way I understand it, Jordy, correct me if I'm wrong, it's kind of loosely guided by this cooperative agreement between AUCD and MCHB, that there's some technical assistance regarding NEARS available to the PPCs through MCHB through that cooperative agreement.
I believe that that's included as well, but I don't know like how detailed that extends or whatnot. Yeah. And I think certainly that that exists for the DBPs. I believe it's also for the PPCs.
Okay. In the interest of time, I just want to kind of keep talking. It's already 5 minutes till the hour. I can't believe that we've already talked almost an hour. So real quick, we're going to table the discussion of REDCap, and we would encourage anyone who wants to innovate and to give it a try this year to feel free to go ahead and do so. I did want to ask Randy, I know you in Arizona, you had been kind of experimenting with replacing some of the NEARS functions with some Excel files, and you had sent them to a couple people to look at, I think, a year and a half ago. And I just wondered if you would be interested in sharing just for 2 minutes about what that experience has been like.
Yes, I can share that. In fact, I even, let me see if I can find it while I chat, but I found my Excel spreadsheet. So part of, again, we're trying to revamp and think of a system that worked for collecting consistent data that everybody on the team understood as well, because that's the hardest part. Even amongst PPCs, we have our differences in data, but even amongst our team members, we have our differences in understanding the data and how to accurately report what everyone is doing. So what I tried to develop was just a simple Excel spreadsheet that had what we as PPC needed from like NEARS and some of the data, like when at the end, when everything exports over, you can get a comprehensive, essentially like Excel spreadsheet with everything in it. And there's 5 million columns of stuff you don't need. And it's so annoying. So what I did is I took that ginormous thing that they made, and then I kind of retweaked it for what I thought we needed as a PPC center. And I got rid of all those 5 million columns and just made it more user friendly. And so my goal, which I was sidetracked, but we're going to get back on it now because I thought someone else was going to do it, but it's me, is to have it, all of our staff have this Excel spreadsheet. And right now I'm using a new laptop is what I told Lisa. And so right now it's verifying Excel so that way I can open it. But while it does that, so everyone's going to get this Excel spreadsheet, and then they are going to, whether they want to or not, meet with me I've decided to do it every quarter. And they are going to, using this Excel spreadsheet, give me all of their data and the things that they've done. And then I will build on it every 3 months for the entire year. So that way every quarter I have their latest and greatest data, because trying to get them to enter it themselves wouldn't work and we wouldn't have consistent data. And then waiting until, I was doing it twice a year, and I think we're still missing stuff. It just wasn't soon enough. So please open.
Okay. Can you email us the Excel sheets when you are verified and when you find them? Okay, I think that would be really helpful.
Yeah, I don't know. I was like, it does not even showing up on the share screen option. So great. So I will email that out on the big email link that we have. Okay.
Okay. And the final thing on the agenda, which I probably realizing now I should not have left to the end to talk about, but what do y'all want to do as a database committee? So I think it's been no secret that I had asked to step aside as the chair of the database committee. It's also been no secret that I asked to do that because I intend to retire within the next at most the next, oh, something's happening. Randy's sheets are coming up.
But keep
I
talking.
see that. Okay. So within the next couple of years, I will probably be retiring from UAB. And so I thought, when in looking through the things that would need to be transitioned to someone else, this was one of the things on that list. So it sounds like, though, there's not a tremendous amount of momentum from any individual center to take over the leadership of the database committee. So I started asking questions of the folks at my center saying, well, do we think we need a database committee? Is there enough work here that we need to keep a standing committee? Could this be absorbed by the steering committee, or is there a better way to handle this? And so that was part of the reason I had posed that question to Jordy about what do other groups of grantees do to provide some communication and uniformity to how they collect and report their data. So I just wanted to kind of throw that out there and open up for discussion what folks would like to do and what they see for the future of this committee. How's that for open-ended questions?
Well,
I mean, those are, thank you, Claire, for all of your hard work and dedication with database. And, you know, I guess, I mean, having served as chair of database for quite a few years, times it's really busy, at times it isn't. Really, you know, when we were looking at new performance measures, or really being able to, you know, help justify, you know, that we're doing what we're supposed to be doing to federal government. I guess it, maybe we need to go back to the steering committee and ask them what's the next step. I mean, I don't want to just, you know, farm it off to steering committee, but I don't know if we can answer that question right now.
Okay. Other thoughts?
This is Lisa, and I think the database, when I was on the database committee officially, I thought it was very helpful to always have like a group that you can reach out to, ask questions, what's your experience with this? And we knew exactly who to contact at each center. And I don't want to see the database committee go away, because I think it was always kind of like a security blanket, knowing that somebody else is going through this and I have somebody else to talk to about it. So I really thought that I think it's very helpful.
Okay.
I would echo Lisa's statements about the helpfulness of it, especially again, like being new to database and everything, how helpful it's been, as Lisa has said, to just have like a point person, aka Claire, Claire. You know, a data guru to say the least. And so, but I do appreciate too, at the end of the year, when we all kind of like say, okay, who's exporting, who's doing the thing, you know, what are you guys doing? It is helpful to have just like our group and talk about, you know, what works for us. So I do appreciate the database committee, and I do think it's very helpful. I think steering committee has a lot of their other stuff that they worry about, so I would be apprehensive to give it back to them. But I do think that maybe there's you know, maybe other people who would be interested in joining the database and who love data too. I don't want to deny them.
And I'm happy as your PO also to figure out like if there are things that the committee took on that would be, you know, more helpful coming either from me or clarification coming from me, or, you know, kind of statutory things like your reports are coming up. Like I've seen some questions about, you know, measure 2 on training form. Like this is, you know, I'm happy to share that information to whatever group it makes sense to share it to, whether it's a steering committee, whether it's database committee. But I'm happy to be proactive about that. So let me know what you need, you know, based on your decision, what you need from me as well, to be able to do that better and more efficiently for yourselves as well.
Okay. When I was reflecting on what kind of the functions of the database committee have been, I was recalling, like, when I first started in the PPCs, which was a long time ago, we didn't have performance measures, we didn't have NIRS, we didn't have the electronic handbook, and so there was a lot more need to sort of internally, as a group of grantees, provide that uniformity with how we were reporting and what we were reporting and how we define certain things. And sort of as all those things have been added as tools for the grants, that uniformity has really improved, I think. And now, you know, we're down to the real nitty gritty. I feel like sometimes, like in performance measure 4, how do you count service and what's collaborative in Title V? And, you know, that's kind of our messiest performance measure, and we spend a lot of time on that, but not nearly as much as we used to in years past. Can we chat a bit more about what the chair of the database committee does? You are amazing and irreplaceable. That's funny, Randy. Okay. So honestly, it kind of, somebody said there's times when it's really busy and times when it's not, and that is the truth. Like when we were having to revise the performance measure 14, that was a huge job. I think Ellen or Lisa was the chair of the database committee then. As chair, you're usually called on to do like beta testing of any new system. So with NIRS, they usually will contact the database chair to say, you know, these are the changes for this year. Can you test this out? Or I've done beta testing for EHB and Digis on a couple of occasions. So you're kind of tapped for that. And then it is a lot of questions about, you know, how are people doing their long-term surveys? How are people doing performance measure 4? How do we define this in this performance measure again? Because I forgot from the last time we did it. And so some of it I feel like is being the memory of the committee and being a resource. But honestly, it's not very time consuming. At least not recently. It has not been time consuming. There's usually a big flurry of emails around the time of the export because things can go wonky every fall when the data is exported and answering questions then. And so you bring up a good point, Jordy, I think with, you know, are those questions better directed to the project officer or directed to a peer who's on the database committee? And I don't have a good answer for that. But honestly, the duties are convening twice a year, giving a report to the steering committee every time there's a steering committee call, and then kind of being the point of contact for the Bureau and AUCD and NIRS. And the other members of the committee are the major responsibilities. But it's really not very time consuming. I'm not asking to step aside because of the time commitment. It's more just wanting to groom new leadership as I look to, as Dr. Lyrene would have said, bring the plane in for a smooth landing toward retirement. So does that answer?
Claire, I just wanted to mention that the point about being a peer is actually really important because I can't see from PO standpoint what you see in EHB. And so, I mean, our layout looks similar, but oftentimes if I'm going to like troubleshoot with you, I'm either going to have to screen share with you or I submit, you know, some EHB support request tickets. So that is a really good point there as well.
Yeah. And I know Claudia always used to say she couldn't see NIRS at all. Like so questions for NIRS was, you know, that the project officers were really limited with what they could offer to help with NIRS. So
yeah, even Michelle's interaction with NIRS, I think, is limited to the export. So
yeah, okay, all right. So it's already way past the top of the hour. So it sounds like we don't have any immediate solutions for right now, but we want to take this back to the steering committee, and they meet again the 1st of October. And so it sounds like we want to put it back on their agenda or we've not been able to come up with a volunteer for a center to volunteer to take over leadership at present. And so we would like input from the steering committee on how to best resolve that. One person may have proposed, should we share it with the steering committee rotation so that a center would have leadership of both committees? Does anybody have thoughts about that, or should we rotate it more frequently? The database committee chair has always been just a chair it till you want to pass it along. We've not ever had a specific term of service the way we used to for our steering committee. So any thoughts about those two things?
Claire, I just wanted to add that I, think that there is value, with database, and, agree with Lisa on that. And you've pointed out, appreciate your time so much. You've pointed out so many helpful tips, since I've been on the grant, and it's been, very helpful. So appreciate that. I know for Washington for this year and hosting the annual meeting, as far as I know, I don't think that we could do the chair this year.
Okay. Yeah, and every center is definitely juggling, lots of responsibility. There's always turnover. People, there's new faculty coming. There's people that have retired, like Susan Horkey in Florida. That leaves a big void there. And so things are shifting around. And so each center knows best kind of what they can and can't take on. And so I think, I appreciate your honesty. Laura was saying, not this year. We can't do it this year. So, okay. Well, other thoughts or other key messages we should send back to the steering committee? Ellen, are you writing all this down?
I'm doing my best, but actually Angela pointed out to me that since I'm recording this, I can go back and get the pieces that I'm missing. So, so I guess in my mind, to summarize what we're saying is that we do feel that database committee is important, or a database point of contact at each center, and how we move on from there, and to have a committee and leadership, we're going to kind of go to the steering committee and ask them to help us problem solve.
Yeah,
does that sound right?
I think that sounds right. That sounds like what we're asking.
Okay.
And I'm happy to stay on until we kind of figure something out. I just, in all fairness, wanted to let folks know, this is
maybe someone would be willing to kind of co-chair it with you for a little while, Claire, if you would be willing to stay on, so that they can feel like they can kind of move into that position, especially someone that's maybe not so familiar with database, or just afraid to step in and take over as chair immediately.
Yeah, so that's a good idea, Ellen. Yeah, I'll definitely stay on until, kind of we have a resolution.
Thank you.
Yeah, I think that's a great idea. I think co-host, like when I was the chair, I co-hosted with Melanie. So one of us was always there, but didn't have the whole thing on you. So I think even a co-host might or co-chair. So, but I don't know. So it sounds like we want to go back to the steering committee and say, you guys decide what we should do.
Or help us brainstorm. Help us brainstorm.
Maybe we're missing something, or they may have some other ideas. Or maybe there's somebody that's leaving steering that says, well, I don't know that much about database, but I could learn more. And if Claire is willing to send, it wouldn't have to be someone. It makes sense to us that it would be someone who's on the database committee, but it wouldn't necessarily have to be someone until they got to up and running. So that's a thought.
Yeah, and I think beginning of a new grant cycle is always a good time for centers to kind of look at who's wearing what hats, who's on what committees, who's shouldering what responsibilities, and say, does anybody want to switch roles, change? Are people happy with what they're doing, or do we want to change it up? So I think that's a good exercise for centers to go through at the start of a 5-year cycle.
Well, and also, isn't the marketing committee now ad hoc committee? Is that right?
Yes.
So there are people that were on marketing committee that again might be a target group of people might want to try something different.
Okay. Other questions or thoughts? I think that was really important for us to spend as much time as we did with Michelle and Jordy going over the reporting requirements. So I'm sorry if the rest of the agenda got a little bit rushed. But thank you everybody for participating. Thank you everybody for staying and going a little bit over. And let me just summarize real quick. So Jordy, you're gonna maybe check with some of the other groups of grantees that are our size and kind of see how they handle things within their group of grantees. And Lisa, can we consider this notice to the steering committee,
Yes,
since you're chair of steering committee? Okay, duly noted. And then Randy, you are going to email us the copies of the Excel spreadsheets that we didn't have time to look at today, and hopefully let us learn from the great work you've been doing at Arizona. And then I'll go ahead and send the link to NEARS to AUCD, just for anybody that wants to look at that and needs to learn more about that or needs a refresher. Okay, anything I've left out?
Thank you, Claire.
Okay, thanks everybody.
Thank you.
Thank you.
Okay,
Claire,
bye.
bye.